Good evening, parents. Welcome to this another special live workshop. This Children's Day, we are going to give our children a gift of health. In this live, we will be focusing on a very important aspect of childcare, which is crucial for building our child's immunity: vaccination and immunization. Our expert will break down the entire vaccination schedule from birth to boosters during growing years. Right from the time your child is born, they are given a series of vaccines from time to time, each of which plays a very vital role in building their immunity against a wide range of diseases and serious illnesses. Getting your child vaccinated helps to offer a lifelong protection against these. As parents, we always want the best for our children, and when it comes to their health, vaccination is the best possible way to do it. In today's session, we'll learn about the importance of timely vaccination and how these work, as well as address some common parental concerns. For this workshop, we are privileged to have Dr. T. Vijayakumar, Senior Consultant, Pediatrician and Neonatologist, managing 15-bedded Level 3 Neonatal Intensive Care Unit and Pediatric Department in Prashant Super Specialty Hospital, Velachery, who will shed some light on the importance of vaccination and immunization for children. Thank you, Doctor, for joining us.
Thank you, ma'am. Thanks for the nice introduction. Uh, good evening to all. So it has been my pleasure to just join with you today on the Children's Day. I wish all the parents and their kids a happy Children's Day. So every parent, they have their own children. They find it's a treasure, and they want to prevent the child from common communicable disease, and they want to be healthy. Okay, so most of the parents want their child to be in a better way, and they know a lot of things they can just cover. How can they just make their baby to be healthy, and how they are going to prepare their child for the future. And once they start their school going, and they are more agitated about the common illness, what they are going to happen, and the seasonal illness, how they are going to manage. So today's session, we are just going to have a better interactive session. I want all the parents to actively participate. I can just keep on talking, but I want to just know the common concern, what a parent can just want to know about their child care, about the vaccination, how they are going to prevent their child from the common communicable disease and the seasonal illness, and what are the queries in their mind, how can I can help the queries to just get rectified. So we can just keep as a little interactive session. I'm just ready to ask you and listen to your questions and answer your queries. So we can just keep this more interesting and interactive. So we keep for a live and a good interactive session today.
Okay, thank you so much, Doctor. Before we go any further, I would like to inform all the parents who have joined this live that during this live, we'll be taking live questions and Dr. T. Vijay Kumar will be answering them. So, if you have any questions related to immunization, seasonal illnesses, you can ask them in the comments, and then we'll share the answers. So now, uh, Doctor, we'll start with the questions. The My
Yeah,
first question to you is: why is it important to get our child vaccinated?
Your topic today is children's best gift is immunization, and we need to give immunity. So most of the time, the child want to get protected from the common diseases. So once you want to just prevent your child to get disease free, or to just to get rid of the common infections what you are going through, better we need to have some type of immunization. Sometimes the natural immunity can play. Sometimes when natural immunity is not working, there are some dreadful communicable diseases we see in our community. Straight from the start of humanity, our human race is fighting against various dreadful diseases. Any infection is a curse to our humanity. So once in last 100 years, once the introduction of vaccines and immunizations, our scientist has done, so human race is trying to survive by fighting against the infection with some natural resources and vaccinations what we can just go through. So vaccination and immunization is a best boon and gift given to a child to prevent against a natural serious infections a child can get. Coming to the point, all infections cannot be just prevented through vaccinations. There are only hardly 20 to 25 common communicable diseases we can just prevent through vaccinations. So while we are just going through a common flu or any diarrheal disease or any other respiratory illness, there is no vaccines available. After this COVID pandemic, everybody knows the importance of vaccine because the worldwide there is some infection which is going on and the world is stamping totally, and we can't just move further because of some infections and threat. We lost our family members, relatives, friends, and other thing, and we know the importance of vaccine now, so we don't have any questions. Vaccine can prevent a serious illness and it can hamper a pandemic to come to an end. So not only it prevents serious infections, vaccines can prevent complications from a serious illness what is going on. Infection has two parts. One is a mild infection which is going on that can be countered with some few medicines or taking rest and other thing. But there is some severe complications a disease or communicable disease can go through. And vaccines can prevent all the age group evenly, not only the infants and child, elderly people, adolescent people also can get, and they can just get immune to the system. Immunity can be built up in them with the proper vaccinations. And again, vaccination play a major role in establishing a herd immunity. That's what happened after COVID pandemic. Once most of the persons are getting vaccinated, the disease progress has been stopped and the community spread has been stopped. Once everybody got a vaccination, not even 100% vaccination status was achieved, at least 60 to 70% when herd or the common population has got vaccination, we can just came to an end with the herd immunity what was going on. And even vaccinations prevent deadly diseases, and it reduces the burden of admitting the baby or any adult to just to get hospitalized, and the health cost is going to be more higher. So by vaccinating a child or to an adult, we can just cut short the money what is involved in hospitalization, how we are going to just manage even the healthcare cost which is spent by the government in just managing babies or once they get the disease. But by preventing, this health cost has been considerably reduced, and they have a better benefits because of this. So vaccination is a mandatory thing. Any baby or adult, when it's mandatorily it's needed, so we have to just proceed with it, and there is no question whether to get the vaccine or not. Whenever possible and whatever the communicable disease we can just prevent, and our child can be just given a better protection, better to go ahead with it. And any parent should remember any vaccination which is given to the child is a healthcare thing. It is beneficial for the money, and it's beneficial for them for the future. That prevents any dreadful disease or any complications that can make the child to just succumb to the disease. So we should be more careful in addressing the thing. And any queries related with the vaccination, we are ready to address. So keep your questions one by one. We are just ready to answer this.
Okay, that was incredibly insightful, doctor. So, my next question to you is, how do vaccines work? Like, what is the science behind them?
Vaccine is a biological component. Okay, it has to be given to the person. It may be any baby or adult. It can be given through an intramuscular injection, sometimes an IV route, or sometimes it can be given intranasally, or sometimes orally also. Vaccines are available in fewer forms. So most of the injections are given with an intramuscular, where kids and the parents are more afraid to get the vaccine because of a prick. But one prick and one thing is going to protect the life and protect the baby to a next level. So this is going to be mandatory. Don't worry about the thing. Nowadays newer vaccines are available with less pain and less side effects, and we have to just go through it. So vaccine, once it is introduced to the body, it is in any form, as I already said, that establish a proper immune response. Our body has an immunity. Once some antigen, vaccine is an antigen, so that contains some part of microorganism what is there. It may be a split particle, or sometimes it may be a live attenuated vaccine we say. That means the vaccine is reduced with the virulence. It won't cause a disease once the way it enters the body, but the vaccine established an immune response that antibodies are produced against a particular disease what we are going to aim at. And once this immune response was there, our memory cells in the body, that means there are some part of cells, we say it's a memory cells, that keep it in this memory whether this organism, we have a proper antibody, this is a pathogen or this is going to be a culprit. Once in any of the lifetime this virus or bacteria enter into a body, again this memory cells comes into play and recognize this as a potential pathogen or culprit, and any or substantial rise in antibody has been done, and our body protects to the particular disease what we are exposed to. So this is a mechanism how we are going to just get it from once antigen or vaccine was given to our body. With the proper antibody response, it may be there. Some vaccines need only one shot. Some vaccines need a booster shots to just boost up the immunity to establish a proper response. Because over time, whatever the vaccine or antigen response as stored as an antibody response, it's going to wane off. So once we have to just top up with some few antigen doses, then only the proper booster and the immunity would be response in a better way.
Okay.
Any other
Thank
questions regarding your scientific aspect, or I'm going in the more of scientific part?
We might have a few more, and then the questions coming in from the parents' side. Let's see.
Okay, yeah, fine.
So that information was really helpful. And I think before we go any further, I would again like to remind the parents that we are taking live questions. So, in case you have any queries, please feel free to share them. So, let's move on to the next question. What
Yeah,
is the
fine.
recommended vaccination schedule for children in India?
For children, we have some fewer list of vaccines that is covered by the basic series of vaccines by the government, and some new vaccines has been added or extra vaccine has been added in the private sector. First, we'll go through the government has started vaccination program since 1970s, and it introduced as a vaccination program, expanded immunization program, and finally in 1985 that was named as expanded program on immunization and universal program of immunization that has been there. From there we are just started some basic vaccines. First, at birth any baby has to be given a BCG vaccine. We say vaccine against tuberculosis vaccine will be giving in the left upper arm. So as soon as the baby born or within 24 to 48 hours before the baby gets discharged from the hospital, this BCG, we say it's a intradermal injection that has to be given in the left upper arm. Most of the babies who was born after 90s are 2000. We can just see a single scar in the left upper arm. That is a BCG scar. We can just see this is the first vaccine a baby can get. And again, along with BCG, we give a oral polio vaccine. That is an oral vaccine that prevents polio virus or polio disease. And third one is hepatitis B vaccine. So this can be given in the thigh, and this is the first dose of the hepatitis B vaccine. We can have three series of hepatitis B vaccine or four. Depends on the schedule what we are going to follow. So first, the primary at birth vaccine is BCG, hepatitis B, and polio virus vaccine. So again, next comes a 1.5, 2.5, and 3.5 months vaccine. We can just have a hexavalent, a combination of vaccine. Government is giving a pentavalent vaccine with an injectable polio vaccine. In government schedule, pentavalent vaccine includes diphtheria, wild pertussis, tetanus, hepatitis B, and H influenza. We say it's a Haemophilus influenza type B vaccine. These are the five components of the pentavalent vaccine that was given in the thigh for the babies around 1.5 months as a first schedule. We are just giving this is a primary series of vaccine. We can just go through. Along with this primary series of vaccine, the baby was given an injectable polio vaccine. Now a newer one, that's a pneumococcal conjugate vaccine, has been introduced by the government, and even the private sector we are also started giving for long. This is a cost effective vaccine. Previously there is considered more costly, and that gives a dreadful disease of pneumococcal disease that may infect a common thing as otitis media, and again a dreadful thing with a bloodstream infection. It may cause meningitis or pneumonia. So this will have a dreadful effect on the babies. So pneumococcal is the one of the vaccine. So 1.5 month schedule, we give the pentavalent component along with the injectable polio and the pneumococcal vaccine. So again, by 2.5 and 3.5 months, we repeat the same dose. Government skips a few vaccines in the middle. It may be second pneumococcal vaccine at 10 weeks is skipped. That second vaccine is given at the 3.5 month schedule. So once 2.5 months, again we repeat the pentavalent component, that is diphtheria, wild pertussis, or it may be isolella pertussis in the private sector, and again H influenza and hepatitis B, and we can just include the uh, injectable polio as a separate thing. In private sector, we have a hexavalent vaccine that is included as injectable polio also included in this list. We can just give it. So again, 1.5, 2.5, and 3.5 months, we give this hexavalent vaccine. We can just go through. Along with this, again, we can include oral rotavirus vaccine. This can be given. You want to just go to the entire schedule, or we'll stop in the middle and we can just go ahead. Azi?
Mm, I guess we can move to the next question now. This
Yeah.
was really informative. I'm really impressed by your knowledge, doctor. So
Yeah.
now let's move to the
No
next
problem.
question.
Main thing I want to highlight on this is some patients or parents, they have a tendency to lose one of the schedule or they can't stick to the schedule. But my
Yeah.
advice is this is a primary series of vaccine and we have a booster doses beyond 1 month, 1 year, what we are going to do. And we need to just get the primary series. Another one is ninth month, we'll be giving measles, mumps, and rubella. Government is giving us measles and rubella vaccine. So this has to be included as a primary series, and again, a booster dose was given at 1.5 months, the diphtheria, pertussis, and tetanus component. Again, with the H influenza and injectable polio can be included around 1.5 years. And again, around 5 years, we can go for a booster dose, and around 10 years of diphtheria and tetanus H influenza booster, we have to include. And in between, there are few schedules that is included in the private sector. We have few vaccines to add on. We'll be giving hepatitis A, that is a fecal-oral transmission. We are preventing against hepatitis. So hepatitis A vaccine we can add up. And chickenpox vaccine, we have two schedules, 0 3 or 0 6 months, we can just give it. And again, we can just go for an influenza vaccine. We have to just go ahead and it. And again, we can just go with the typhoid vaccine. These are all vaccines which is included in the private sector, that is not included in the government sector.
Okay. Thank you, doctor. So now let's move on to the next question, which is uh, what are the various important vaccine guidelines that parents should know of?
Guidelines, as I already said, there is a list that was given by our government for a primary series who are all just getting from the government sector. And as I said, there is some few vaccines that is included. In a private sector, there are this, along with the same vaccine that is included in the government, as I already included, few vaccines has been included, just like hepatitis A, influenza, typhoid, and few other vaccines. Japanese encephalitis that is given by both government and private sector also. So we have a hexavalent vaccine that is a combination of vaccine that is with a less side effects. We can just go ahead. We can just have a debate between a wild pertussis vaccine used by in the common sector that is can be included in the private sector also, but this is going to have a less side effects. The needle is little more less painful compared with the wild pertussis vaccine, which can be included in the hexavalent vaccine. So this gives a better benefit to the baby and the parents. This will soothe, they have less side effects. The patient won't have much of fever or pain or local site reactions like swelling, redness, or anything. So the guidelines, the schedule matters a lot. So everybody was given a schedule of vaccine according to Indian Academy of Pediatrics, who has formed a schedule of vaccine, basic vaccines to be given to the child who is born. And most of the babies, they are discharged with a vaccine card after giving the first primary series of vaccine. What I said, the BCG, hepatitis B, and oral polio. And the second schedule was given, and the parents were instructed to just follow us after 1.5 months with the second series of vaccine. They can just go ahead. So they have to have the vaccine card in their hand and they have to follow the schedule accordingly. Every time they get the previous vaccine, so next vaccination schedule can be written by the pediatrician in the card so that they can follow without any delay. Now, lot of doctors are having a app that can give reminders to the kid. So the next vaccination due date can be popped off 1 week prior and just 1 day prior and on the date of vaccination so that the parents can follow their kids vaccination schedule. They won't miss it at any cost.
So, why is it important to stick to the schedule?
Vaccination, as I already said, it's going to protect a common communicable disease. That too, diphtheria, pertussis, tetanus. These are all the first culprits that have that endangered human races because diphtheria had a second part. What we see now, it's not a major thing. Diphtheria has an antidiphtheritic serum that is going to have an impact on the heart and that may cause deadly disease. And most of the babies who are infected with a severe diphtheria previously, they died a lot. And again, tetanus, we have a separate ward for tetanus. We say it's a tetanus ward. The babies or adult who was infected with the tetanus may have a continuous spasm and they scream like anything. And this tetanus ward has been totally eradicated because of widespread immunization, which was started early in the 70s and 80s. Now, government has achieved a lot, but now because of some parents start missing the boosters or missing the initial series of vaccine, resurgence of disease. Previously what we have achieved a control of particular disease, now the disease start emerging as a new variant and the parents can see their child or even an adolescent are getting infected with the diphtheria. Now new cases has been reported in a few places of India, even western states, United States we have seen. So now it create an awareness. If you miss a particular series of vaccine or if you're not sticking to the schedule, the babies may not have a proper immunity and they are the person who is going to have a dreadful disease if the proper antibody response, the baby is not exposed to a particular disease. Say if a diphtheria vaccine was not given to the baby, when the baby was given to exposed to a diphtheria infection, this baby is going to have a dreadful disease and the baby has to fight with their life and the morbidity and mortality is going to be higher. So I advise the parents, whatever the government is predicting to just prevent the communicable disease, this is everybody's right or the child's right. We should not deny a child's right to get immune against particular disease because out of 100 children, if one or two children is not going to vaccinated with a particular disease, these two children are odd man out among the another 98 babies who is there. Because when these two kids are going to expose with any disease, they are going to face a worse situations in their disease pattern what they are going to. So even if they miss few days, 3 days, 5 days, or a week, they can just follow on the schedule. Nothing wrong in
Yeah.
just waiting more than 1 or 2 weeks. They can stick to the schedule, and doctors or paramedics can just postpone their schedule or prepone their schedule. Depends on the thing. But at least 4 weeks gap should be given between the first vaccination
Yeah.
and the second vaccination for a proper antibody response to be established in a baby when which was vaccinated with a particular disease.
Thank you so much, doctor. So let's move to the next question, which is, does the need for vaccine vary based on geographical locations?
Yeah, depends. In India, we are endemic for many diseases. Okay, compared to Western states, UK and United States, we are more prone for any communicable disease. Particularly, I can example in US, tuberculosis is nothing. They are not going to bother about tuberculosis. But for us, again, we still the government, even our common people are fighting for tuberculosis. That's why we aim at giving a first shot of BCG even before the baby was discharged because the baby is going to be exposed with a tuberculosis vaccine at any time of its life with the surrounding person who are all going to take care of these babies. So not only tuberculosis, we are more prone for a lot of diarrheal diseases straight from rotavirus vaccine, which is the commonest cause of diarrhea, and other seasonal diseases like measles, mumps, rubella, and other things. Depends on the geographical area, depends on the climatic condition, whether it's going to be a winter or it's an autumn or sometimes it's going to be a summer. We have a lot of variations in vaccination types and infection type also. When there is a rainy season is on, we are going to have more of common flu, and again a swine flu or H1N1 may surge, and again we are just going more risk for measles, mumps, and rubella during the rainy seasons. In summer days, we do have lot of diseases like chickenpox and other summer-related diseases like skin issues may play a role. So their vaccines and vaccination type or immunization may vary with the thing. So in India, we are covering maximum number of vaccines what we are going to cover compared with the western states like United States of America and UK, where typhoid or BCG and this hepatitis A is not going to be included in their schedule. They just concentrate more on the primary series of vaccine: diphtheria, pneumococcal vaccine, even pertussis, tetanus, and they concentrate more on meningococcal vaccines. That is a type which causes another brain fever that may cause. So it depends on the variations. There are some changes in thing. Coming to our Indian counterpart, we do just face a lot of more diseases, and our government is facing to just struggling to just protect more diseases compared with any of the countries because we are still in the developing stage and we are just going ahead.
Okay. So I can see we have a lot of parent questions.
Yeah, we
So
can
I think we should like address some of them. So the first one is from Gayatri, which is my 2-year-old daughter is due for her next round of vaccinations. Are there any potential side effects that I should be aware of?
which vaccine they are going to get it. 2 year
She
old
has
child is
not
going to get.
she's
Oh,
saying 2-year-old daughter is due for her next round of vaccinations.
okay. Any vaccination what we are going to give have only a minimal side effects. Okay, 90%. Okay, around less than 5% they are having uh, uh, little more complications like high grade fever. Sometimes there may be some local swelling or pain. Sometimes they may have some rashes, some anaphylaxis, some reactions may occur. But this is very rare with the newer vaccine what was introduced now. So most of the vaccines are safe and they pass through the CDC, we say Center for Disease for Prevention and ACIP guidelines. So most of them are scrutinized and they have lot of studies before a vaccine was given, and their side effects, safety profile, vaccine efficacy has been studied in very detailed manner. So don't worry about any of the vaccines. Till now, you have got the vaccine and you didn't have any much of side effect, I hope anyway. So again, don't worry about the vaccine what you are going to give next. That is not going to have much of side effects. By 2 years you should have gone for a typhoid booster, sometimes with a meningococcal booster or the first dose of meningococcal vaccine you are going to get. But these two are safer. It's a conjugate vaccine. Mostly this is not going to cause any serious complications, so you can straight away safely go for the vaccines. Don't worry much about this, Gayatri.
Our next question is from Kiran, which is my 6-month-old son is scheduled for his first flu shot. Is it safe to vaccinate him now, especially considering he's so young?
6 months is a schedule for flu dose. We have to prevent the child. Okay. Now, in India, wherever it may be, it's October, November is the season for winter season. Now, the flu spread is going to start till February. We have increasing number of flu cases. So now in India, we see lot of flu positive cases. We do witnessing in South India, particularly in Chennai around. We are seeing lot of flu cases. So 6 months and 7 months is the right time you can prevent your child, because your 6 months old child now is more active, playful. They want to just move on to person, and the baby's interactivity and handling persons are increasing. So this time the baby is going to have bad infections from any of the counterparts, because now adults are getting more infection and we do confer a common flu or a swine flu. This is going to have an impact on the baby also. Once the baby get a flu without vaccination, the immune is very less and the baby is going to get a dreadful disease. better to vaccinate with the child because already your baby has gone with the primary series of vaccine 1.5, 2.5, and 3.5 months. So now we are going to get only the flu shot that is not going to have any complications. The baby will be protected against the flu. We advise that the flu has to be just given. You can contact your pediatrician for more details. This is a better part to just get an immunization so that your baby will get the prevention against flu. So it's mandatory so that this season and you have to just go on.
Okay, thank you, doctor. So the
Right.
next question is, how can we protect children from vaccine preventable diseases during travel?
Travel, there are few vaccines which is mandatory. So international travel, we have to get a yellow fever certificate sometimes for particular countries, particularly Africa. And a few other vaccines, as I already said, flu has been included. Some include against MMR. Some depends on the countries. The need for vaccination is different. Previously, we never include COVID in the travel details. Now we need to get a COVID certificate for most of the countries' entry because still there are some mild infection which is going on. So we have to get a basic series of vaccine. Depends on the country where we are traveling, and we can just get a thing from the embassy and which vaccine has to be mandatorily given. So you can get the thing. So common vaccines, there are list of vaccines which can be recommended for travel. Particular thing I want to mention is yellow fever, even hepatitis A in a few countries, and sometimes it may be Japanese encephalitis. Sometimes it may be with the hepatitis B and A, and few vaccines, including the flu, has to be included in the list. But it varies, depends on the country where we are going to travel.
Okay. So our next question is from Premlata, which is, my 4-year-old daughter had a mild fever after her last vaccination. Should I be concerned about getting her vaccinated again?
Getting a mild fever is a very common side effect for any vaccine. It may be a diphtheria, tetanus, or maybe a pneumococcal conjugate vaccine or typhoid vaccine. We don't want to worry about a low grade fever, what we are going to see after a vaccination that hardly lasts for 24 to 48 hours. That won't be very high. And the baby is otherwise fine, and the baby is not going to have any trouble. We are not going to bother. When we have to bother after a vaccination or a dreadful complication means after a vaccination, when the baby is having a high grade fever that is more than 102, 103, and degree fever, the baby is going to run that too for 40 to 72 hours, and there is a severe anaphylactic reaction. There is some rashes. It may be some component of the vaccine may create some rashes or sometimes edema. We may say it's a puffiness of the eyelids, puffiness of the mouth, or even sometimes the whole body may be involved with rashes or some itching reactions. Sometimes the baby may have some seizures after this. Sometimes the vaccines very rarely may have some paralysis or any other major illness. This concern, you have to just remind and you have to intimate your pediatrician or your healthcare worker before you get the vaccine. If it is only a low grade fever or local pain or small swelling that spontaneously decreases, this is not a contraindication or a concern. You can go with your future vaccines also without any trouble. So don't worry about minor illness. That is going to be safe and it's not going to be repeated all the times.
Okay. So Komal has a question, which is the HPV vaccine safe for my 11-year-old daughter?
Yeah, now the newer concept is to prevent against human papilloma virus, which is going to cause cervical cancer. Not only that, it is going to be a cause for even common what we are going to have. Even both boys and girls can be getting this vaccine. Even adolescent is the right time. We can just get between 10 to 15 years. Any baby can just safely given a HPV vaccine because less than 15 years we have a two-dose schedule 0 and 6 months. This is going to prevent the human papilloma virus, so this gives a better immune response and the babies will be less risk for having a cervical cancer. Sometimes even we can just prevent for the boys also for some anogenital CAs, carcinomas, and sometimes even a common wart. So this don't have a much of side effects. Sometimes there may be some local pain or low grade fever, as I already said. This is not a concern, so you can safely go ahead with your baby's vaccination, Komal. Don't worry too much about this.
Okay. So, next question is from Kirti, which is, what should I do if my child misses a vaccination?
Depends how long it's there. So once you miss a vaccination within the last month schedule you are missing now, straight away go ahead with the vaccine. Nothing wrong. If you miss for 3 to 6 months together, you can contact your pediatrician. So don't need to just wait. You can just start from the miss schedule and you can just continue the vaccine. So if it is more than 1 or 2 years, you have to contact and have a list of mandatory vaccine. Depends on the age. Your pediatrician can schedule the baby's mandatory vaccine, because if you are missing 1.5 year schedule, you are coming around 3.5 or 4 years, we have a booster dose nearby around 4 to 5 years. So we have to just schedule your vaccine. Depends if it is more than years together. If it is just a 1 or 2 months, nothing to wait. You can just go to the schedule and you can just follow on the schedule as such. Nothing to worry. So depends when you miss the schedule, how long you have missed the schedule, you need to just address. So your pediatrician can give you a proper idea. But if it is 1 or 2 months, I recommend to just follow and stick to the schedule. If it is more than years, we need to plan few schedules has to be adjusted, because follow-on vaccines and booster dose are in the middle. So we need to accordingly plan.
Okay, thank you, doctor. So, we have a question from Akanksha. My 10-year-old son is about to start middle school. Should he get the meningitis vaccine?
Yes, I can, sir. This is a valid question. Now, the meningococcal vaccine is a newer introduction. Previously, because of the cost effectiveness and this thing, it was not included in the schedule. Now, in the private sector, we do have a meningococcal vaccine that can be given somewhere around 10 to 12 months of age, or we can just schedule somewhere around 1.5 to 2 years. So, this meningococcal vaccine, now the incidence is increasing, because lot of shuffling is just happening and we are traveling all around, and the chance of getting infection is high. And not only this, the meningococcal vaccine has a dreadful fall. Once the baby is not vaccinated against meningococcal disease, the meningococcal disease has a serious effects, and the baby can be sicker and they have some more morbidity and mortality within 24 to 48 hours of infection. So, considering this fact, it's better to just get your child immunized with the meningococcal disease, where this disease is going to be more dreadful. And we have seen uh, losing some babies with meningococcal diseases. It not only for prevention, uh, meningococcal vaccine is mandatory even for international travel, or if you are planning to go abroad and settle, because in US and UK, this meningococcal is a primary series of vaccine. It's included in their schedule. So it's better for prevention of disease in our setup, what we are living. And when we are going to travel, or when the baby is going to just complete their primary schools or in the college days, when they are going to go abroad, this is going to be a mandatory one. So for this, I recommend to just prevent meningococcal diseases with a vaccine, so that your baby may be immune by now, so that the deadliest part of disease can be prevented if it is was exposed to. Even though the exposure is less, we do have some cases across all over India, in few states of India, what we are just seeing. But it's better to vaccinate. So most of the private sector now, they started giving the meningococcal vaccine in their regular series in the immunization list. Even IAP, Indian Academy of Pediatrics, is recommending somewhere between 10 months to 12 months, or around 2 years of age, we can get the schedule.
Okay, thank you so much, doctor. So, we have a question from Shivangi. Is it safe to administer multiple vaccines in a single visit? How does this impact the child's immune system?
Mostly, if it is a kill vaccine, what we are going to see, are a conjugate vaccine. So we can combine two vaccines at a time. So more than two vaccines, it's questionable. We don't want to give, because most of the vaccines what we use now, it may be a trivalent, even a quadrivalent or pentavalent. That includes 3 or 4 antigens together, it prevents at least 4 to 5 a pentavalent or quadrivalent, or it may be hexavalent vaccine. So even a single vaccine is going to establish a proper antibody response for at least 4 to 5 or 6 antigens are in a virus or bacteria. So again, if you are giving a second vaccine, so it's going to be having a better effect. So you can consider two sites, two injections at a time, not more than two. So that will again complicate the process, and the babies have some issues with getting more vaccines. So stick to two vaccines at a time. Mostly we'll be combining vaccines. Most of the vaccines we plan in our schedule, we do give two at a time. So mostly live vaccines we want to space out at least 4 weeks apart. So if it is a kill vaccine or a conjugate or a normal vaccine, it's a toxoid vaccine, we do give two vaccines at a time, and any conjugate vaccines can be given together, but in different sites we need to just give it. So we can combine two vaccines at a time, not more than two.
Okay, so two vaccines at a time.
Yeah.
Okay, thank you, doctor. So, next question is from Anjali. What are the benefits of the DPT vaccine and how often should my child receive it?
DPT is the primary series of vaccine. Already I said anyway. It's 1.5, 2.5, and 3.5 months is the primary series. After the baby was born, we are going to have. And again, we do have a booster dose around 1.5 years. And the baby may have a booster dose of diphtheria, pertussis, and tetanus around 4 to 5 years of age. And we want to give Tdap, that is a reduced dose of pertussis and diphtheria toxin along with tetanus. We can give it around 10 years. So put together, there are three main series of primary series of vaccine less than 1 year. So 1 to 2 years, we are going to give a booster dose. And again, booster dose is going to be repeated around 4 to 5 years and at 10 years of age. So we need to complete all the primary series and the booster dose of vaccine for a proper immunity against diphtheria, pertussis, and tetanus, because this is going to have a previous risk-taking diseases what we see in the uh, long years. So now we have a control of infection because of widespread vaccination coverage, and more vaccines of DPT has been introduced all over India. So this is going to have a better effect on controlling the disease. So stick to the primary series and the three booster doses.
Okay, thank you so much, doctor. We are now coming towards the end of this live session. And before we close it up, I want you to share some insights and sum up the whole session in a few words.
Yeah. Anyway, thanks for the wonderful session. I'm happy to be an interactive part with this session today on Children's Day Eve to just have a better insight for vaccine to the parents. And vaccines are going to have an impact. So of life. So we should not miss any series of vaccine in the schedule what the child was given. So we need to stick to the schedule. Even if you miss the schedule, better you just contact your pediatrician. We are ready to just reschedule your vaccines. And you want to discuss about particular vaccine. Now somebody has asked for meningococcal, somebody has asked for DPT about this, and you want to just know more information about this, we can just have a personal discussion with your pediatrician. We are there to help you. And don't be afraid of getting a shot. Even nowadays, it's more difficult to convince a parents more than a kid. We are able to just manage a kid, and more than the parents are more apprehensive, and they are little fearsome to just take the vaccines, because sometimes they what they hear from their colleagues, they have some dreadful thing. But now what we see in the private sector, we have a safer vaccine and a combination vaccine that is readily available with less side effects that won't cause any dreadful diseases. Most of the vaccines have WHO approval, and vaccines are going through series of bodies are controlling the vaccine type, the efficacy, and what the vaccine has to be given, how it has to be administered, and lot of local studies and international studies are available. And paramedics and the medical persons are constantly looking on any of the major side effects that is happen after introduction of the vaccines, and any serious issues are widely taken care, and they are just notified. And any dreadful issues are managed. At recent stage, I'm practicing for last 15 to 20 years. I didn't see any of my kids are getting a serious vaccine related issues. Most of the vaccines what we give is safe. So don't worry about unnecessary things. Vaccine is a best gift for your baby, as already the topic narrates. So we need to give whatever the health cost, whether you are going to give crores and crores for your baby, just few vaccines and immunity what you are giving through few vaccines may cost better for your baby's betterment of your life and baby's life. So you should be more careful in choosing better vaccines, and you can just talk to your pediatrician again what against whatever the queries you have and whatever the fear you have to just clarify. So
Thank you so
keep
much,
in track.
doctor.
Thank you.
Thank you.
Welcome.